Blood is very important to us, and we live in a place where our blood is being targeted by diseases. One of these is dengue. Dengue is a mosquito-borne viral infection which is transmitted to humans through the bite of a female infective Aedes mosquito. It belongs to the genus Flavivirus, family Flaviviridae. This family includes yellow virus, West Nile virus, and Zika virus. This disease occurs on the tropical and subtropical region. On the data given, there are many variables related to dengue, such as admission and discharge, BMI, fever, and other symptoms. Using the data given, here are some graphical representation of the data and its relationship with each other.
The correlation of dengue patients' hematologic profile to hospitalization days. This bar graph shows the hematologic profile of dengue patients, specifically the average white blood cells or leukocytes, platelet count or thrombocytes, and hematocrit, as well as the duration of hospitalization. Based on the graph, the average count of white blood cells is inversely proportional to the length of stay of the patients. In other words, as the hospitalization day increases, the white blood cells decreases as well. This trend is supported by the research conducted by Tinambunan et al. 2018. They found out that leukocyte value correlates with hospitalization duration. However, there is no correlation between elevated hematocrit and thrombocytes. Platelet count of dengue patients. This area graph shows the trend of platelet count of patients with dengue. Platelet count is a predictive parameter during dengue infection. Based on this graph, younger patients tend to have a decreased platelet count and are more susceptible to thrombocytopenia during dengue infection. According to the study of Khan et al. 2014, patients less than 15 years of age tend to have a lower platelet count.
The graph above shows that patients with a lower platelet count may also manifest occurrences of vomiting and the presence of rashes, all of which are indicative of severe dengue disease development among patients, according to Zhang et al. In 2014. It can be seen in the bar graph that the blue bars, which indicate the presence of vomiting among patients, are often but not always lower than the green ones, meaning they are also the patients with a lower platelet count. It is also noticeable that the green line, which indicates the presence of rashes, is placed significantly lower than the blue line, meaning those with a lower platelet count may also manifest rashes. However, the presence of rashes and vomiting is not always predictive of the length of hospitalization, according to Aror et al. In 2015, as seen on the 7th to 8th day, where there is an absence of both vomiting and rashes in some cases. This is not always true, as seen on the 9th to 10th day, where the patients have a lower platelet count as well as the presence of rashes, while having no data shown on the occurrence of vomiting. The scatter plot, along with the linear regression, shows that there is no significant correlation between the platelet count, length of stay in the ICU, and the disposition upon discharge, as evident in both the presence of a sloping down and straight or leveled regression line. Though one of the lines sloped down, there were outliers that have failed to make this negatively correlated. To explain this, it can be seen on the 0 to 2 days length of ICU stay how there were patients who have a low platelet count but has spent a short amount of time in the ICU, possibly due to external influences such as financial restrictions, referrals, personal preferences, and or immediate treatment. There are also some patients who have a low platelet count and has died even with a longer duration of stay in the ICU. Conversely, there are also patients who have a low platelet count, has stayed longer in the ICU, and has shown to have improved conditions. Studies such as of Malhi et al. In 2017 and Viratmadja et al. In 2018 has not mentioned the significance of platelet count as compared to other factors such as multiple organ dysfunction and elevated leukocytes in determining the length of ICU stay.
This graph shows the relationship between gender and symptoms of patients infected with dengue. Based on the graph, dengue is most likely to occur in men than in women. According to a study, 88.6% of dengue cases causes fever. Additionally, it is also stated that males were more likely to be infected than females. Dengue is a disease that is very prominent in our country. Recently, there was a dengue outbreak that happened in the Philippines where many died because of different factors. such as unpreparedness, poor environmental sanitation, and lack of knowledge about the said disease. Through the graphs presented, we can use it to further study the disease and create new ways on how to prevent and cure it. As medical technology students, it is us who understands these diseases and it is our job to prevent it. We can do it by educating other people with different precautions and clear all misunderstandings concerning vaccines and other medical treatment. We play an important role in creating a disease-free environment and a healthy community.